Today we're going to talk about leukemia. Leukemia is not only a blood cancer but also a failure of hematologic homeostasis. So, what is leukemia? It is the proliferation of immature white blood cells. Its cases are 2.5% worldwide and it's most common in Asia and Africa. Now, let's talk about the causes. What are the causes of leukemia? There are two types of the causes, environmental causes and the genetic. Now let's talk about the environmental causes. What are the major environmental causes? So first one is the ionization and radiotherapy, chemotherapy, and the industries which include the rubber and petroleum industry, tobacco, which contains the major cause of leukemia, that's benzene, and exposure to various chemicals. Now moving towards the genetic causes of leukemia. So first one is the chromosomal deletion. That means the part of the chromosome is absent. Second is the trisosomes, which means there is existence of an extra chromosome. And the third and the last one is the chromosomal translocation. So basically what is translocation? It's simple. Consider two chromosomes, chromosome number 22 and chromosome number 9. The part of chromosome 9 and 22 are translocated with each other. Now moving towards the types of leukemia. There are two major types, myeloid leukemia and lymphoid leukemia. What is myeloid leukemia? It is the proliferation of the cells from the monocytes and the granulocytes. Monocytes are the simple cells and granulocytes include the eosinophils, neutrophils and the basophils. Moving towards the lymphoid leukemia, it is the proliferation of the cells from B cells and T cells. They are further divided into acute and chronic. Acute leukemia consists of the acute myeloid leukemia and chronic leukemia consists of chronic myeloid leukemia. They both are common in adults and caused by the translocation of the chromosomes. AML has further a branch which is acute promyelocytic leukemia, which arose from the promyelocytes and is caused by the chromosomal translocation between the chromosome number 15 and 17, which causes a fused gene, which is PML or RARA. That causes the rapid division of the stem cells, which leads to leukemia. Moving towards the lymphoid leukemia, it has acute type, acute lymphocytic leukemia, and a chronic type, chronic lymphoblastic leukemia. Acute lymphocytic leukemia is common in children and CLL is common in young adults. They both are caused by the proliferation of B cells, and CLL has a unique type which is the polytypical chromosomes that has the translocation of chromosome number 9 and 22 and causes the fused gene formation, which causes the rapid proliferation of the stem cells leading to leukemia. CLL also has a unique type called the hair-like leukemia in which the B cells have the hair-like projections around their cells. For example, if this is a B cell, it will have hair-like projections like these around it and it will cause the mutated division of the stem cells. Now coming towards the symptoms of leukemia, it includes pain and tenderness in bones due to the bone marrow expansion. It includes anemia, which causes fatigue and pain. pale color. It includes thrombocytopenia, which causes the depletion of platelets and the blood clotting is reduced. It includes leukopenia, which increases the infection susceptibility by reducing the white blood cells. It's also important to diagnose leukemia, and there are several different ways to diagnose. One of them is taking patient's history. It includes the physical examination, blood smears, biopsy, which is one of the major way to diagnose leukemia, because the blast cells, which are normally 5% in the bone marrow, in the state of leukemia, they exceed 20%. Now, moving towards the treatments of leukemia. One of the major treatment for leukemia is the stem cell therapy, which is normally known as the bone marrow transplant. In bone marrow transplant, the unhealthy stem cells are replaced by the healthy stem cells, and it consists of three main types, which is the autogenic, allogenic, and syngeneic. Autogenic is using the stem cells from the same person. Allogenic is using the stem cells from the natural donor, and syngeneic is the using stem cells of the identical twin. Normally, the immune system is capable of identifying and destroying the early stages cancer cells. But in case of leukemia, the T cells are destroyed and the NK cells are dysfunctional, along with the cytokine imbalance, and the body is unable to defend against the leukemia cells. Leukemia is no longer a death sentence. Why? Because we have several therapies including immunotherapy, Cas9 therapy, stem cell bone marrow transplant therapy, and future AI perspectives of RNA-based personalized therapy and AI-guided medicines. And with that, leukemia does not cause now death as it causes in the era of early 19th century, when the Rudolf Virchow identified disease as leukemia and said that it's not an infectious disease but a problem of the stem cells. With that, we come to the end of our lecture for today. That was all about leukemia. I hope you were able to understand what leukemia is, how it is caused, what are the types of leukemia, what are the symptoms, how to diagnose leukemia, and what are the possible treatments for leukemia. Thank you so much for attending today's lecture.